Okay, tape identification, interview with Dr. Underwood, the Ministry of Health and Human Services regarding the COVID-19 situation. Doc, thank you very much for taking the time off from your busy schedule. I know that you've been on top of everything with the ministry and especially regarding the COVID-19 spreading in the community. But Doctor, we just wanted to kindly ask if you could provide us with an overview of the current situation now. As you know, we are in the community spreading and in code red. Can you provide us an overview of what the situation like right now, please?
Okay, thank you, Tari, and good morning to you and all the listeners out there. Since 4:30 on Monday, when the first cases of COVID-19 was reported in the community, the situation changed in terms of conditions. We went from border cases to community spread. From that time to the morning, we had over 20 cases identified in the community, coming from different areas of Majuro, as well as hospital staff. That to us signified that this virus had been probably circulating in the community for up to 1 week. Okay, so that means community transmission is occurring. Yesterday, we reported the first case also on Ibai. So Ibai is also reporting community transmission. Now, when His Excellency the President made his speech on Monday night, one of those decisions that the cabinet had taken was to temporarily stop inter-island travel. Okay. However, as I said, this virus has been around for a few days, and a number of flights had gone to the neighboring islands. Some ships were recalled from the neighboring islands, but there is also a potential that it has spread to some islands already. So we're in a case of community transmission. Yesterday, 53 cases were reported. But I want the public to understand that this is an under-representation of what the actual numbers of COVID in the community is, because we are only picking them up per testing, right? And we notify that, but we know there's more people. Now, as more testing sites become available, those numbers will start to increase, okay? Yesterday, we also recorded our first death. This was a 22 individual who unfortunately presented dead on arrival, and everyone who presents dead on arrival in a hospital now also undergoes COVID testing, and unfortunately his test was positive. And our condolences to the family in that regard. But I'll talk more about our messages to the community a bit later on, perhaps. So that's where we are right now, and the overriding objective right now is to ensure that people who have COVID or potentially have COVID have access to testing services and treatment, okay? That's why alternate care sites will be set up, and 2 sites have been established today. One is at MIHS to service the Rita Ulinga area. That's probably going to be activated this hour, and also at Delap Elementary School. And we'll talk about that more a bit later on. We're also preparing to send response teams to the neighboring islands should that be required, and shipping out test kits. Okay? All right.
All right, Kumul Doctor, thank you very much. You've already mentioned the alternate test sites.
Yes.
Test sites already, and we've already put this alternate test site on the air.
Right.
I understand that there is also a confusion circulating around the community in regards to people not going into quarantine anymore.
Right.
And I understand that the quarantine sites on Majuro has already been closed.
Yes.
And personnel used to manage these quarantine sites have been dispersed to help with the current situation right now. Can you please elaborate on that? Why was the decision to close down or eliminate all these quarantine sites, please?
Okay, basically because community transmission had occurred already. So we quarantine people traveling from abroad so that when we release them, they do not pose a threat to the community. So in effect, keeping COVID out of the community. Now, inevitably that has occurred. That no longer has a role in our strategy for eliminating COVID-19 from the community. It's there. So A person who comes from overseas and not doing any quarantine but having a negative test as they board the plane may already be exposed to COVID-19 and be incubating. And there are many people in our community here already exposed to COVID-19 and also incubating. So what I'm trying to say is the risk posed by someone coming from abroad, as well as anyone in the community now on Majuro and Ibai, is the same. Okay, so there's no need for institutionalized quarantine. Secondly, it's something that serves no purpose, and it ties up to about 8 to 12 staff, health, police. So we need to redirect them to where they're best suited or needed at this time in our emergency response. Okay, so just to clarify, people coming from abroad, they still need to test negative before they board the plane. That's also a public health responsibility to international air travel. But upon arrival, they are also tested. The purpose of this test on arrival is what we call test to treat. If someone has risk factors for severe disease, okay, the risk factors for severe disease I'll go over a bit later, but if they have risk factors, they need to receive medications specific for COVID-19, and that's the purpose. But after that, they go home whether they're positive or negative, okay, and they do their own quarantine. Someone who is positive needs to stay at home for up to 5 days. A person who is negative can still leave the house, but anyone in the community in the Marshall Islands outside of their home need to wear a mask for the next 2 to 3 months. And so that's what we require them to do. Wear a mask if you're negative on arrival. And if you have symptoms, then that person needs to present to a alternate care site. Okay.
All right. Thank you very much, Doctor, again.
Before you go on, we had maintained quarantine on Kwajalein, but as of yesterday, we no longer will be doing quarantine on Kwajalein as well, okay? Because it's spread to Ibai.
Yeah, okay.
All right.
What about on Kwajalein as well?
Usaka, we're still in discussions with Usaka, so I cannot say or preempt any decisions that they would make, but I'm sure they will inform us in due time.
Okay. People are also confused about a plane coming in from Fiji. I think there are a lot of people, 40-some people, and among those people are health workers.
Right.
And I think we need them at this stage. Can you tell us about this plane and about the situation that we don't need to quarantine for 10 days. We don't need that already. Same as with the compact negotiating team.
Right. So as I said, there's no role for institutionalized quarantine at the moment. The flight in Fiji was initially slated as a medical evacuation for a person here going back, but we took the opportunity to bring in people, surge staff under umbrella of PIHOA and other agencies, regular government RMI hires, to bring them in. And this is essential staff for Ibai and Majuro Hospital, which we need at this time. We also took the opportunity to bring in dependents of staff that are already here and other government persons working for government who needs to come in. Also a few from the private sector. 32 persons have been approved. They need to have negative tests before they can board that plane. Anyone entering the RMI still need to be vaccinated. Okay, that's one of the requirements that Cabinet has put into place. But once they come, they'll be tested on arrival. Positive people will be assigned their risks and receive medications, and they undergo their home quarantine, which is 5 days for positive cases. Negative cases can enter the community, but they need to wear a mask. Besides this, as part of the Ministry of Health's response, we have sought assistance from CDC, ROC government, and this is for medical practitioners and public health specialists who will help in our responses. And we should have them boots on the ground starting from Tuesday next week. So most of the initial flights, which we'll be bringing people in, is for response to this state of health emergency. Yep.
All right. Thank you very much again, Doctor. These are really very, very important information. Okay. I saw you in one of your emails about the home test kits.
Right.
Can you also tell us how important it is to to consider all this when you test positive?
Right.
What are the steps to take? And where to contact?
Well, this question is part of a larger question on how people can access health services right now. So I'll start with people who've got a home test kit, and people have been ordering that from the US. US government had a program, or people may have bought it. If you're positive on a home test kit, if you have risk factors for severe disease, this is like 50 years and above, having diabetes, having a heart disease, including hypertension or previous heart attack or stroke, if you have got asthma, tuberculosis, you taking any medications that weakens your immune system, if you have a high body mass index, so if you're overweight, then these are risk factors for severe disease. If you have any of those, then you need access to Paxlovid and other medications. And the only way to access that in the Marshall Islands right now is from our test to treat site or emergency room. So if you have those and you in Majuro, you need to go to either Rita MIHS or Dillop Elementary School. Now, if you have symptoms of severe disease already, you're short of breath, you have a family member who's acting confused, sleeping more than they should, lying in bed, they cannot get out of bed. The tips of their fingers and toes are becoming blue. This means that they could have severe COVID disease. They need to be brought to the emergency room, not to an alternate care site, but emergency room. There are special medications for them, and they can be admitted to the ICU facility, and that's the best place for them to come. Now, if you are at home, you don't have a test kit, you fit one of these categories, especially risk factors, you go to those alternate care sites. Okay. Now, after hours, from 5 o'clock to 10 o'clock, we also have a facility open at the tennis court near the hospital, and we thank the tennis club of Majuro for assisting with this. Also, individuals after that, after 12 o'clock to 8 o'clock in the morning can also present to the emergency department. They will also be screening and providing these services.
Thank you very much, Doc. I've been visiting these alternate sites since this morning, and I've seen a very long queue.
Right.
So I'm just wondering, what about all government employees want to get tested, so they leave the office? Is there a plan to have your team or visit some of the offices to get the employees tested in the office?
Well, the issue with health at the moment is we've got a workforce that is pretty stretched in terms of numbers on the ground, compounded by people who test positive. So we will not be able to do testing in individual offices. But if your department has a testing policy, we can support that with training on testing and provision of tests. And if anyone tests positive there and have those risk factors, they go to alternate care site. Now, I want to just, ask the public to be a bit patient today. This is the first time those sites will be operational. There were some delays. We want to improve services on a daily basis. So today will be a bit rough, but tomorrow will be much better, okay? And those clinics are slated to open from 10 a.m. to 10 p.m. And if demand is high, it's going to go for 24 hours.
Oh, okay.
Okay.
Right. Okay.
There are other sites planned. Laura High School. We want to set up one at Long Island Elementary School for the folks down Ryrok, and Ajal Taki Elementary School for those in the connections between Laura and Ryrok.
Is there any tentative date or sites?
We're trying to get that up by next week.
Next week?
Yep.
Okay.
Yep.
Okay. All right. Thank you very much, Doc. I don't want to take more of your time. I'm sure you're a very, very busy man, really, in this time of. What are your final words to the public on this situation right now?
Well, few. One, this regards people with chronic diseases who may be running out of medications. From Monday, they can come to the alternate care sites to get their prescription fills for medications for diabetes and hypertension. Anyone out of medications right now, we're trying to get a mechanism how they can get their prescriptions filled at the hospital. But that may be something that will happen tomorrow. If they are acutely out of medications and they don't feel good, come to the emergency department. They will be able to triage you and provide you the care that you need right now. But we don't want people to die of other diseases when they can be on medications to control that in this time that we are facing a COVID outbreak. Okay. The rest of the population, wear a mask when you go outside. If you're feeling sick and you don't have risk factors for severe disease, especially the young people, you take Tylenol, you take rest, you adequately hydrate yourself. Disease will spread fast in the community. We expect that in 4 to 6 weeks, it may be over in Ibai and Medjugorje. The variant that we suspect is in the community is VA 5.0, and the reason why is because 15 individuals from our quarantine sites, they have undergone, their samples have undergone genomic testing, that's what it is. This is the same variant in FSM and in most places. Highly transmissible, so it'll spread fast, regardless of many of our best efforts in the home, because it's hard to control breathing in a house. But in the community, wear a mask will help, okay? Containing the spread if they are vulnerable people. That's the basic message to the community. Keep calm at this time, bear with us, and if you have any questions, ask and ask. Over.
Thank you very much, Dr. Komor Dana, for your time.